can only happen if more South Africans and all South Africans do exactly the same thing, and therefore we can then reduce the need, the risk of the viral infection spreading. That's a very, very important message, because if we don't, there is a huge risk that when we open up more activities, more economic activities, which we must because the country has to begin to adjust to building its economy, growing properly, and at the same time making sure that we are ultimately able to get jobs and food security for everybody. But when that happens, we're likely to get the numbers going up again, and that might be worse than what we've seen now. It's important for South Africans to actually appreciate that. And so we do need to make a call. We want to be making this call again to local leaders, community leaders, traditional leaders, and church leaders. Let's limit funerals to 50. Let's reduce large meetings. Let's avoid having big bashes and parties. Let's avoid having situations where people are milling together and therefore unable to ensure that there are containment measures. All of this becomes important, because the battle, the COVID-19 battle, will not be defeated only in the hospital bed. It will be also defeated in the community out there by each and every South African who will participate in the containment measures, making sure that they wash their hands, they use the mask, they make sure when we use the mask properly. A few people walk around with the mask on their chins, on their necks, and some of them in their pockets. That is not right. What we need is the mask must be on the person's on the cover the nose and cover the mouth. And when I think those who are at home, you need to use whatever you can to boost your immunity. Use of vitamins, very, very important, and also making sure people are staying physically fit and avoid getting exposed to flus. But diabetes, we must keep it under control. Blood pressure must be kept under control. People who have got HIV treatment, they must take their medication. People who are on TB treatment, they must take their medication and continue to do the test. We would like mothers to bring their children to the hospital to be checked properly, and they must be immunized. The mothers who are pregnant must come and check their pregnancies properly. So everybody needs to be looking after themselves, because if we do so, we're then able to even defeat the COVID-19. We're going to have to learn to live with COVID-19. As long as we don't have the vaccine, we're going to have to learn to use these new ways of dealing with COVID-19. Thank you very much, and thanks for your interest. And if you've got questions, we can take a few, and then thank you very much. Okay, I'll take the questions. I'll do this afterwards.
Okay. Thanks, colleagues. We're going to introduce ourselves and direct the question to Minister or to MEC. We'll take one round. 1 round. 1, 2, 3, 4.
Good afternoon, Minister. Jayed-Leigh Paulse from the SABC. Just a question with regards to the process of people who are waiting for the results but who have succumbed to COVID-19 and died at home. Just take us through that process, Minister, for those who aren't sure if they've lost a loved one at home, and what do they do with the body?
Well, we have asked that the Director General must send a circular to the funeral parlors, because the funeral parlors, no person is supposed to be buried without a death certificate, and no death certificate should be issued unless signed by the doctor who confirms it. And we are asking those doctors to assist us to participate at that level. So they should discuss the issue between the funeral parlor and the attending doctor who signs the death certificate. We're going to be issuing circulars to guide them so that we can have a seamless approach at that level, because it's a new issue. It's already been done in a few other provinces, but it's a new issue. We would need to make sure that there's an understanding. We want to do it for 2 reasons. One, we would like that such tests should be done and returned fairly quickly so that people know how to manage their situation. But more than that, we're worrying about those remaining behind. They must be tested. I just got a report just now, a request, somebody who's lost an aunt and just said, look, all my relatives are sitting together. Now we've just got the results confirmed. Now what do? Now we send that information around. We also issued out a number, what we call COVID Connect. So as soon as people got their test done, they can put their names and make an inquiry in that number. And we're going to push there must be a short turnaround time. Turnaround time of about 48 hours is important for us, so that by the time there's a need for the body to be buried, there are results. But I think it's also important to say, if anybody has died and you're not sure, then I think you must take all the precautions. In any case, the problem with death during these days is not so much whether the person who is COVID positive or died of COVID-19 is going to cause you an infection. The problem is, how do we behave, those all of us who are not seemingly sick, because we might be having an infection and still spreading it around, and we're not able to share that. So when we hug each other and we cry and we're holding each other and we're crowded in a small place and so on, we're coughing and sneezing, all those things are what really contributes. And so the restrictions on funerals, we know it's very difficult. This is Africa. Everybody is very sensitive about how you deal with those who have departed. We know it's a very sad one. Particularly imagine that you might not have been able to see the person in the hospital because of the restrictions. But we can't do otherwise. We have to really try and save as many people from infection. Should I chair now?
I think you're the second one.
Well, I'll take it.
Yeah, you can go.
I think this is a question more for the MEC. Once the pandemic is over, and we hope it will be soon, will hospitals like the Nie-meyer Memorial Hospital in Utrecht be turned back into general hospitals, since they are one of the main areas for primary health care in the region?
Yes, thank you for that question. It's a very good question. It gives us an opportunity to explain ourselves. Certainly, we have a few hospitals that around November, December last year, we were not utilizing fully. I mean, the bed capacity at some point was about 30% utilization. And around November, we submitted as a province a request to the Provincial Executive Council that we be allowed to repurpose those facilities. So we're in the process of restructuring. Now, when COVID came, it then redirected us a little bit. But a hospital, in fact, our plan initially was to convert Nie-meyer Hospital into a CHC so that we are able to utilize the facilities that are this side because they are bigger. But now with the investment that is there, including the issue of ICU equipment and everything that has been put in, it will continue to operate as a district hospital once we are done with COVID-19. However, with our discussion with the head of department and his management, we might have to look at the specialties that we actually put in that facility, but it will go back. Yesterday we went to Richmond Hospital, which used to be a TP hospital. It's now going to run as a district hospital, and even there we'll discuss on the nature of specialties that we are going to put there. So yes, the facilities that we have repurposed, particularly those that we've brought back that had not been functioning for a while, will continue to operate as proper hospitals.
Esther?
Thank you.
Hi, I'm Esther from the Northern Natal News. I'd like to find out if you are able to quantify the rate of recurring infection in South Africa and how this contributes to the death. And also in terms of the rate of recurring infection, people who are infected for a second time. And also in terms of healthcare workers who are tested for COVID-19, while they are awaiting their test results, they are still at work, and by the time they realize they are positive, their isolation period is over. So during that time in which they were positive for COVID-19, they are still at work instead of self-isolating. And I'd like to